In healthcare, protecting a patient's privacy isn't extra. It's part of safe, respectful care, and it helps build the trust every patient deserves. HIPAA is a federal law that helps protect private health information. In simple terms, it sets rules for how patient details must be kept secure and confidential. That means you only access, use, or share patient information when it's needed for care, billing, operations, or another approved work purpose. Protected information can include names, birth dates, addresses, phone numbers, insurance details, medical conditions, test results, and anything that could identify a patient. You might see that information at the front desk, in a pharmacy, in dental care, in behavioral health, or while updating records. Privacy applies in every one of those roles. Privacy risks often show up in ordinary moments, like talking about a patient in a hallway, elevator, or waiting room where others can hear. Another risk is opening a chart just because you're curious, even if you're not involved in that patient's care. If you don't need the information for your job, don't access it. The professional response is simple. Move sensitive conversations to private spaces, lower your voice, and only view records when your role requires it. Technology creates risks too. An unlocked screen, a shared password, or sending patient details through personal text messages can expose information fast. The same goes for social media. Never post about patients, even if you leave out a name, because small details can still reveal who someone is. Imagine a friend says they saw someone they know at your clinic and asks why that person was there. That can feel casual, but it's still private information. A professional response would be, "I can't discuss anything about patients." That keeps the boundary clear, respectful, and fully confidential. Protect privacy by pausing before you speak, locking screens, keeping passwords private, and asking a supervisor when you're unsure. As you do your work, ask yourself whether your next action protects trust, safety, professionalism, and patient dignity.